name is Carolina Pacheco, and I will be presenting a quick PowerPoint presentation on a mobile app called Quick Lab Reference. So, a quick introduction to Quick Lab Reference is it is an up-to-date information app on the most used clinical laboratory values like hemoglobin, hematocrit, white blood cells, and many more. It also provides information on normal vital signs, EKG, frequently used anti-infective drug levels, acid balance, Glasgow Coma Scale, hemodynamics, just to name a few. It provides quick access to a plethora of information related to lab values for blood tests, non-blood tests, bacteriology, microbiology, toxicology, genetics, and pregnancy, normal pathophysiology, and it even contains a tab that's called miscellaneous, which has information like how to draw up blood into the collection tubes. Moving right along, this application is a great success because it is straight to the point. So when you open up the app, you get to select what reference you're looking for. So if it's a blood test, you would select that, and then under that tab, you would go ahead and click on CBC, which would then give you the values for hemoglobin, hematocrit, and so on. Under each of that, there is a drop box that says more information, which I believe is a complete absolute necessity to this app, because if you do not know what the lab value or the lab test that is being done is, then it gives you a quick brief paragraph that can help someone understand what it is and what it's trying to measure. The usability of any app is important, and for good reason. People in the healthcare profession want something that's quick, straight to the point, especially when it is needed on a whim. So this does that for you. It separates it by women and men lab values, pediatrics and adults. So this steps to access is very easy. You just open it, click, and the information is available for a number of different topics and values as needed. So that is definitely the best part of this app. There is no endless searching and surfing to find an answer. It's direct and pain-free. The legal and ethical, just like every app, there are disclaimers, which basically make sure that the developer is not held liable. And just by saying something like the information should not be considered medical advice. One of the privacy notes states that the app does not collect, use, share, or sell any personal information, user's health information, and the location of the user's device, which is very good. Another disclaimer, it says that this application is as is, and it is provided on a basis without warranties of any kind, and it does not guarantee this application will ideally work for every user and on every mobile device. My overall analysis of this app is that it's a quick, great, free reference guide when information is needed. Just a few cons that I noticed was I was not able to locate the developer's credentials, so I do not know who created this app or what his credentials or her credentials are, and I did not find any references to where these lab values and information was retrieved. However, I did do my own research through several medical books, and I found that all the labs seem to match. Of course, there's always off a little bit depending on your institution, which is why I do advise when a nurse or some other healthcare professional downloads this app to compare these values to that of the institution you work before relying on it for the values. In conclusion, I do believe this information is an absolute necessity to any healthcare worker. I recommend this app to fellow nurses because it is very useful in our busy professions where this information is needed on a whim. I do advise, like I said, to compare these values with that of the institution you work for before relying on it for the values. Thank you so much for listening into my presentation, and I hope you have a great day.